Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. Today's topic I have taken is about salivary glands. As its name salivary glands, the glands which secrete saliva and diseases related to the saliva. Now we have important salivary glands, major and minor salivary glands. The major salivary glands are parotid gland on both sides, submandibular gland, sublingual gland and multiple minor salivary glands inside your mouth. So today I am going to talk about submandibular salivary gland, that is in this area. Now why salivary glands are important? Because they secrete saliva. Saliva is not just a fluid in your mouth. It is important, it has lot of functions. Like when you eat food, if it is a dry food or solid food, it needs some lubrication so that you can easily swallow it and food should go inside. If it is very dry, it will be very difficult to swallow and then you have to drink water. That's why saliva is important. So saliva gives lubrication, first function of it. Then second one, saliva, the digestion of the food starts in your mouth. It's not starting from your stomach, it starts from your mouth. So saliva secretes lot of digestive enzymes which helps in digesting the food starting from your mouth. That's why you should chew and eat so that it nicely gets mixed up with saliva and it goes down. Third function is antimicrobial properties. Saliva has lot of antimicrobial properties. It kills the microorganisms which are harmful to our body when you start chewing the food and once it gets mixed with the saliva. It has lot of antibodies present in the saliva, so whenever you are eating food, it provides the antibodies to your body along with the food. So now next thing is anatomy of the salivary gland. So first I am going to talk is about submandibular salivary gland. This gland is situated in the submandibular triangle, in this area. Submandibular triangle, it is behind the mandible. This is called as a mandible bone and this gland is behind this or below this area. It has two parts, superficial and deep lobe. It has a tube, a duct which connects and opens inside your mouth just below your tongue. If you open your mouth and raise the tongue up, touch, then you will see the two small ducts or the saliva coming out from that area. First condition I will discuss is acute submandibular salivary, that is infection or inflammation of the submandibular gland. Now, and salilithiasis, that is formation of the stone in the saliva, salivary stones. Now what are the causes why the salivary affection happens in the submandibular glands or salivary glands? Causes of acute submandibular salivary, why it happens? Submandibular salivary gland secretes saliva. It's a major salivary gland and it secretes lot of saliva. The saliva of submandibular gland is thicker compared to parotid gland or sublingual glands or minor salivary glands. Because it is thicker, it has to drain the saliva anti-gravity. That is, the duct is going from below up, so it has to go up. So all these anatomical factors are important and can cause the problems in acute submandibular salivaritis. Now that is called is an infection or inflammation of the salivary gland, submandibular salivary gland. So the causes of it is most common bacteria which causes staphylococcus. The factors which can lead to formation of salivaritis. First thing is dehydration. If you are not drinking adequate water, the saliva will be thicker. As the water is less, the saliva formation will be more thicker and secretions will become more thick, then you will be prone for infection. If oral hygiene is not well maintained, like you are not brushing teeth regularly, that hygiene is not good, then infection can happen. If your oral microbial flora, that is our mouth will have a lot of normal bacterial flora in the mouth. That bacterial flora, if it increases due to some conditions like your immunity is down, post-surgery dehydration can happen. So and chronic illness, like when you are sick, when not taking oral hygiene properly, your immunity is down, that time the oral cavity bacterial flora increases, dehydration happens, it affects the salivary glands and it can cause infection of the salivary gland. Now if you ask me which age factor is common, any age can get affected, but mostly it happens in elderly age as a person gets older. Which sex group gets affected, like males or females, it can affect commonly both the groups. Now what are the clinical features? Now how patient will present to the doctor? Patient might have a swelling in this area, that is submandibular triangle. In this either of the side, patient can come present with a swelling, pain in that area, and the patient will say that pain is increasing, swelling also is increasing in size. Patient might have fever, patient might have difficulty in swallowing. Patient will also complain sometimes there might be formation of a swelling with abscess. Sometimes it can discharge abscess from that area. If the severity of infection becomes more, the submandibular gland infection can become into abscess. That abscess can drain inside your mouth, that is below the tongue you can see the pus coming out, or it can cause infection of your entire floor of the mouth. That is all the area inside the mouth below the tongue area will get infected. That is more serious condition, and that can be life-threatening condition called as a Ludwig's angina, because it will cause increased swelling, edema, and it can cause the compression of the windpipe also, and you will find difficulty in breathing in that. What doctor will examine when you go to the doctor with this condition? There will be swelling in this area. Doctor will try to see whether there is any pus coming from that area, how is the skin over that area, whether there is a bulge, any redness is there, any pus discharge is happening. Doctor will gently touch that area and see whether what is the size of the swelling. Other than this swelling, are there any lymph nodes in this area? Whenever the infection happens, the lymph nodes also get affected. If you have watched my previous video, I have discussed about lymph nodes and the importance of the lymph nodes. Then doctor will check inside your oral cavity. He will check whether there is a caries tooth or recently any dental procedure has been done. He will check the duct coming from the submandibular gland which opens below the tongue. He will gently press in this area to see if the saliva is coming or pus is coming from that area. He will rule out the infection inside the entire oral cavity. He might touch and try to palpate the gland from inside and outside to check for any stones in the duct. What are the investigations you can expect? Investigations, doctor will first confirm clinically that it is acute infection of the submandibular gland, and other investigations like complete blood checkup you will do to rule out the infection you are having. He will check the creatinine also. If you have diabetes, doctor will check the sugars. Then doctor might ask you to undergo the sonography to see if there is underlying abscess. If there is abscess inside, is there any stone inside, what is the size, how big is the gland, and to get the details about the gland. Another test which if the sonography is not helpful, doctor might ask you to go for CT scan also. Another test which can be done if doctor is suspicious of other than infection is fine needle aspiration cytology to rule out any, like if doctor is suspicious of any tumor or cancer in that area, doctor might go ahead with doing FNAC. Now if you ask me what are the treatment for this, the treatment is medical and surgical. Doctor will first give you the medical treatment, like first doctor will ask you to rehydrate yourself. Doctor will make sure you are rehydrated, drinking adequate quantity of water, warm compresses to apply warmth in this area. Now if it is infected, doctor will give you antibiotic course on an OPD basis and see how you are responding. The doctor will also give you the anti-inflammatory medicines to decrease the size and swelling of that area. Doctor will give you mouthwash so that you mouthwash to gargle and improve the oral hygiene. Doctor will ask you to brush twice a day. And if the medical management doesn't help, or the patient is getting a recurrent infection, like once antibiotics are given, infection is settling, but if it is coming back again and again, the option remains is the surgical management. That is removal of the affected gland. Doctor will refer to the surgeon, and the surgeon will assess you and he will plan for the surgery. In that, the submandibular salivary gland has been removed from this area. It will be done under general anesthesia. You have to get admitted for 1 day, and under anesthesia, doctor will open from this area, will find out the gland. He will remove the entire gland. He will ligate the duct inside. If there are any stones, doctor will take out that stones also. This surgery is important as there are the important nerves related to this gland. The nerve, like lingual nerve and hypoglossal nerve, both are very closely related to this gland. So surgeon will make sure that he is protecting both the nerves and taking out your entire affected gland safely. Post surgery, there will be a single line suture that mostly will be absorbable suture, or sometimes doctor might put removable sutures. Follow-up will be for 5 days to 10 days, and once it is healed, Then if it is recurrent salidinitis, doctor will ask you to come follow up for the opposite side also. You should make sure that you are drinking adequate quantity of water. You are keeping good oral hygiene, that brushing the teeth twice a day, if required doing a gargles or mouth washes. If any infection in this area, swelling, pain, you should meet a doctor and get it checked to rule out any possibility of salivary gland infection or any other swelling. Next video I am going to talk about silolithiasis, that is stone arising from the saliva, salivary stones. How to treat, what are the symptoms, signs and investigations, how to treat it, we will discuss. Thank you for watching me and listening to me. Thank you very much.